Dr. John Torres here, Dr. John with NBC News on this Facebook Live. This is the last Facebook Live in 2020, and what a year 2020 has been. And we'll go over some of the things that have happened this past year and some of the things we're looking at going forward here. But first, I want to talk about a few headlines that you've probably heard over the last few days. Give you some information behind those headlines so you have an understanding of what it means, and more importantly, what it means for you, your loved ones, your family, your community, and hopefully how it can help you get through this pandemic a little sooner and a little easier. On top of that, I love answering questions that you have, so if you have questions, please send them my way, and we'll go ahead and answer as many of those as we can. But first, let's start with a couple of topics. One are the variants of the virus you might have heard about. I'm in Colorado. I'm literally about 35 miles away from where the first confirmed case of this new variant that came out of the UK was noticed here in the United States. This little town called Simla, Colorado. It's a town of about 25,000 people. And it was in somebody who was in the National Guard, the Colorado National Guard, working in an assisted living facility. The reason the National Guard was there was because people in the facility, the staff, a lot of them had gotten sick with COVID and were not able to work, so they brought in the National Guard to help out. The people living in the assisted living center, there's about 25 of them, have all gotten COVID as well. And so the thinking is it might possibly be coming from there, but they're testing individuals right now who have not found the source at the assisted living center, so they're looking further at the contacts themselves. They have one confirmed case. It's a 20-year-old that is very healthy and has not traveled recently. And so it's not as if the person went to the UK and came back here. There's a second case that they're suspected might be the same case of this variant virus as well. And now they have a case in Southern California that's confirmed. But what does that mean? They're confirmed, and what does that mean for the rest of us? And what does that mean for this actual virus? First, let me take a little bit of a step back. The virus is, this strain of the virus is called the B117. And it's a variant strain from the original virus. And what has been happening is, since the virus first came out of Wuhan, China, they have been following it, genetically looking at it, to see if it had naturally change constantly. That's how viruses stay alive, is they basically constantly change. They're trying to evade our immune system. They're trying to evade the vaccines, the treatments, any of those things we have, so they constantly change. Up until now, those changes have been insignificant. They've been little changes that really haven't amounted to much. This one's a little bit bigger of a change, but it's still not a significant change in the fact that, yes, we think it makes the virus more transmissible, which means that more people can catch it, more people can spread it, but it doesn't look like it makes the virus any more dangerous. In other words, people aren't getting any more serious complications from this strain of the virus than they are from the other strains of coronavirus, and they aren't dying any more than they are the other strains. However, and this is an important point, the fact that it's more transmissible means that more people might get it. And just doing the math here, if more people get it, more people are going to have serious complications and more people are going to die from it just by the percentages themselves. And so even though it's not more dangerous, the fact that it can spread more means that it could cause more issues. And I know that gets a bit complicated, but the important part here is right now, the measures we're using, wearing a mask, social distancing, washing your hands, being in small groups, ventilating areas, those all still work against this virus. And so they're extremely important to make sure we keep continuing to do that thing. On top of that, our therapeutics look like they work against this strain of the virus as well. And the vaccines that have come out look like they work against this virus as well. They're doing more testing. Both Pfizer and Moderna are testing now to make sure, but by all indications, it looks like they will work against this strain. Now, again, there are no significant modifications to the strain, no significant changes that would make it, enable it to evade our vaccines, evade our treatments, but at the same time, it's more transmissible. Now, how did all this come about? Well, over the last week or so, there have been cases of this virus popping up in London and in southern England. Not the whole country, but in parts of the country. So a lot of countries said, okay, because this is happening in England, and it seems to be the predominant strain in those regions of England, we want to make sure it doesn't spread to other countries. And so they were requiring testing before people left the country. In some instances, countries shut down any transportation between the two countries for at least 24 hours to try and get it under control. But to a certain extent, this is almost like shutting the barn doors after some of the horses have already gotten out, because they first started noticing the strain back in September, maybe a little earlier, which means the strain was there. And most likely that's how it came to the United States when people were traveling during this time period. Here in the U.S., unfortunately, our system, our sentinel system, surveilling everything to try and find out if this or other variants have cropped up, hasn't been that robust recently. It started off fairly robust in the springtime, and then it tapered off to a certain extent, and they're trying to essentially rebuild that system that can look at samples and take a small percentage of those samples just to survey to see if anything like these variants crop up. This is extremely important for public health issues, especially in the midst of a pandemic, because that gives them an idea of what's out there and what might be coming. Now, if you can think about this assisted living center, if that's the source, well, the people in the assisted living center don't travel much. People travel into them to see them usually. So that means it probably came from outside to them, which means it was already in Colorado. If it was in Colorado, more than likely it was already in other states as well. We have a confirmed case in California. Same thing there. If we have a confirmed case, there are many more cases that haven't been confirmed and have probably been there for some time. So again, these measures people are taking against England will help going forward, but they're not going to help with what's already gotten out up to now. And so we need that surveillance system in order to be able to understand what's in our communities, what's in our nation, and what we need to do to make sure that those stay under control. The concern is, again, this one is sort of a canary in a coal mine saying, okay, we have this one variant that we know can cause more infections. Thankfully, it's not causing any more complications or death than the other coronaviruses. But at the same time, is this a precursor to other strains that might be coming along that could be even worse? At this stage, most researchers, most experts think the coronavirus will continue to change like viruses normally do, but that is not going to change greatly to the point where it can evade the vaccines or the treatments that we have up to date. So keep your fingers crossed that happens, but that means all of us doing our part to keep this virus under control, because the way the viruses change is by spreading. The more they spread, the more people they get into, the more mutations and changes they can have happen. And once that happens, then those mutations can be the advantageous mutations that can take a foothold and start taking over a certain area and then move from there. That's not what we want happening. Now, we know the vaccine is coming, and that's going to help us keep it under control. But while it's coming, we need to make sure that we do the measures. Again, wear a mask, social distance, wash your hands, that we know work to keep it under control as best we can. And that brings me to my next topic. My next topic are the headlines of distribution of the vaccine that you've probably heard about. Well, if you take a step back, and yesterday I had a Facebook Live, what I call the Doc to Doc series with Dr. Ashish Jha. He's the dean of the public health department at Brown University. And talking to him, he said, if you look back at some of the comments that the HHS has made, particularly Secretary Azar, a while ago he was saying we'd have 100 million vaccines by the end of the year. Push that down to 40 million vaccines, push that down to 20 million vaccines. And now, as of now, we're talking about 12 to 14 million vaccines that have been distributed so far. If you listen to Operation Warp Speed, you listen to the people that are running that, they'll say we have distributed 14 million vaccines. At the same time, if you listen to what's going on right now as far as the people that have been vaccinated, numbers around 2 to 3 million people have been vaccinated. So, bit of a disconnect between 14 million distributed, 2 to 3 million vaccinated. Why could that be happening? Well, part of that is the lag. There's about a 7 to 10 day lag in reporting who gets vaccinated. So that certainly could be part of it. Other parts, and some places are complaining that they're not getting the numbers of vaccines that they need. And here, it's hard to drill down exactly what's happening throughout the system, but here is essentially what it looks like, is throughout the system, the distribution is working like this. Operation Warp Speed was in charge of developing, manufacturing, and distributing the vaccine. So they got the development part down, especially with the Moderna vaccine. Manufacturing was done at the same time as the human trials were going on, and now they're in that distribution phase. So they're distributing it to states. But essentially what some states are saying is they're basically leaving it on our doorstep. They're giving us the vaccine and saying, okay, now it's your responsibility to take care of that. And some states aren't necessarily set up to take care of that or have the funding to take care of that. So they're looking to the federal government and say, can you help us out here? Because that next step of preparing a vaccine, well, one, distributing it to where it needs to be, preparing it, and then administering it, giving people the shots, that's the important step that is a bit of a disconnected from those other steps that the Operation Warp Speed is doing. And so how do you get those two together to make sure it's one fluid step all the way from, again, the manufacturing of the vaccine to developing and manufacturing the vaccine to people getting shots in arms? And the way you do that is working together. The federal government having some central oversight, and maybe it's central guidance, maybe it's central funding, but some sort of central oversight to the states to help the states out with what they need to get the vaccines in people's arms. If you think about it, as a country, one of the things we've been very, very good at over history is mobilizing the country behind one significant effort. And that one significant effort, we have really shown that we can get behind that and make sure that we get it under control. Perfect examples. The 1918 pandemic, World War I, World War II, mobilized the country to get those under control as quickly as we could. And in some cases, if you think about World War II, they took over car factories and said, instead of making cars, you're making tanks and airplanes. They had people go out in their communities and recycle rubber. They had people rationing sugar and milk to help out with the war effort at the time. And the point being here that as a nation, we're very good at doing that, but we haven't done that during the pandemic, which is truly an emergency right now. And so that needs to be done. Now, Operation Warp Speed, they did say that one thing they don't want to do is they don't want to invade the states. Again, talking to some experts, they're saying this is not an invasion of the states. This is offering a helping hand to the states. And so, making sure that working in conjunction with the states with what they need. And if you think about it, if you think about recent disasters, even Hurricane Katrina, the National Guard went down there to help out. The military went down there to help out. FEMA went down there to help out. All these federal agencies went down there to help out with the invitation of Louisiana to help them get that under control. That's what's needed here, is making sure we get this under control. If you look at other countries, they're doing mass vaccination events. They're having soccer stadiums open up. They're having either their military or their public health departments or both pushing people through getting vaccinated as quickly as possible and getting many more people vaccinated per population than we are here in the U.S. I think what you're going to see over time is that happening. We're having more and more robust vaccination programs going on. The rollout is going to be much smoother. We knew there would be some hiccups, and we're certainly seeing those, and that is part of it. And once we get those hiccups under control, I think you'll see more vaccine rolling out, more people getting vaccinated. Here in Colorado, where I live right now, they have vaccinated, according to the Governor Paulus, they have vaccinated phase 1A, which are the healthcare workers and those in long-term care facilities. Now they're moving to 1B, which are essential workers and those who are working with patients, but not necessarily directly COVID patients. And then they'll move on to phase 2, which they've changed a little bit to phase 2 here in Colorado, 60-year-olds and above instead of 65 and above, and others with pre-existing medical conditions. They think they'll be doing that in the springtime. So things are moving quickly. They just need, at least according to a lot of experts, move much faster than they're moving right now. And so that's the distribution part of it. It is happening, but until it finishes, again, we all need to do those things that I keep talking about. Wear a mask, social distance, wash your hands. And even after you get your vaccine, you're probably still going to need to do that. Now, I want to go over a real brief 2020, what's happened this year. Well, yesterday was the one-year anniversary of hearing about these cases in Wuhan, China. When we heard about this virus coming out, we heard about people with these strange pneumonias, these clusters of people. And at the time, we paid attention to it, but we weren't paying a lot of attention to it, didn't really know what it meant. Well, you move from there to January, February timeframe when we started seeing it here in the U.S. Later on, it was declared a pandemic by the World Health Organization. And at that point, the ball started rolling in both looking at the vaccine, paying attention to the vaccine, but certainly in the numbers of what was going on with the vaccine. And going over numbers real briefly here, right here in the U.S., almost 20 million cases since the start of the pandemic, over 300,000 deaths since the start of the pandemic. If you look worldwide, almost 83 million cases, and those are just reported cases. 83 million cases, almost 2 million deaths worldwide because of that. And so those are astounding numbers of people that have both had it and died from coronavirus. And we're not even through yet with the pandemic. Some say we might be about halfway through, and certainly these numbers are going to go higher. So what's happened over the past year? Well, over the past year, we've learned a lot about a virus. This is a brand new virus that has been affecting humans since, again, the beginning of the year. And we've learned both in how it transmits. If you remember early on, March, April timeframe, we were talking about if you got a package from a store, you wanted to wipe down the entire package or leave it sitting there for 24 hours. You wanted to take things out carefully, wash your hands, wash everything you had. You were constantly worried about all these contact surfaces. And then we learned that those contact surfaces, in other words, getting them off of surfaces themselves, were one thing you had to make sure that you were aware of, but want to be more concerned about the respiratory droplets that pass from person to person. And then we've discovered, okay, respiratory droplets are one thing, and so that's why that 6-foot distance is important. But also, it's possible that at least part of this in certain situations could become airborne and might go a little further, might linger a little longer. So you have to be extremely careful. And then we realized, okay, there's a couple things you need. We knew masks were important. At the beginning, the word went out, and I certainly said the same thing. We wanted to reserve masks, and these were surgical masks or N95 masks for healthcare workers because we knew there'd be a shortage of them. And so the word was out. At this point, you probably don't need masks yet, but certainly one of those things that healthcare workers do need them, and so let's save them for healthcare workers. Well, very quickly, within a few weeks or a month or so, we realized that masks were important for everybody and started beating the drum about wearing masks constantly, and that added to some confusion. On top of that, we also learned about therapeutics. If you remember hydroxychloroquine, back in the same time frame, we thought hydroxychloroquine might work. The FDA gave it emergency use authorization. And then over time, we learned that it probably didn't work. It didn't work as well as we thought it would. And so the emergency use authorization was rescinded at that point. And so we learned as we went on that some things that did work. One of the surprises, dexamethasone. That's a steroid that's been around far longer than I've been around in medicine. And we found out that that can actually help reduce the number of deaths with coronavirus because of the way coronavirus reacted with our immune system and it caused our immune system to react with our bodies. That was another lesson we learned, how that cytokine storm, a word that probably none of us had heard before the pandemic, became the big buzzword of the springtime, that people were having cytokine storms, which were killing them. And that was basically the immune system going into overdrive because of coronavirus. And then we learned about long haul syndrome. People that had these symptoms that went on for months and months, they might have even recovered, fully recovered, and weeks later started getting more symptoms. And then we learned about the bizarre symptoms of coronavirus. We knew it was a respiratory virus. And so we started talking about flu-like symptoms. But then as people started getting more infected, we learned about some of the other symptoms they had, particularly the loss of sense of smell or taste, which is one of the unique symptoms with coronavirus, and how many people actually were affected by that. And then we learned about the transmission of coronavirus, at least to a certain extent, and the fact that up to 40% of people could have coronavirus and not have any symptoms behind it. And so as time went on, we learned more and more. We started developing convalescent plasma. We started developing these monoclonal antibodies that seem to work. Remdesivir is a medicine that seems to help alleviate the symptoms and the time frame, but didn't seem to help much with the overall deaths of coronavirus. And so it's an important tool we have, along with dexamethasone and some of these other ones. And then the vaccines came along. And none of us before probably had heard of VRBPAC, which is the FDA's advisory committee, ACIP, which is the CDC's advisory committee. But a lot of us were glued to those hearings, which turned out to be very scientific hearings. And so, at a high level discussion of data and information, but at the same time, very interesting to watch how that process worked, not just here, but globally, and how these vaccines were manufactured, approved, and accepted globally. We heard about vaccine hesitancy and now how that has decreased over time, but it's still out there and it's still a huge component. And then herd immunity. We've probably heard about herd immunity in the past, but didn't really realize what it was, but now understand that at least 70%, maybe as many as 90% of us need to have some immunity built up to coronavirus to protect the rest of us. And then the pandemic itself. Again, looking forward into 2021, which I think is going to be a great year, a turning point for this pandemic. It's certainly going to be one of those things where the pandemic is still going to be with us for most of the year, but it's going to get better quickly over time. And by that, I mean more people are going to get vaccinated. We're going to have more people being able to do things that they did in the past, and we're going to have new normals. And I think those new normals are going to include things like masks, where we might use the Asian model of wearing masks if we feel sick. Might have hotspot areas occurring throughout the year, and then saying, okay, if an area is a hotspot, we're going to go ahead and have to put people in masks, social distance, maybe close down for a little bit certain facilities in order to keep it under control, much like we do if there's measles outbreaks or other outbreaks around the country. And I think that is going to be with us for a while. But importantly, I think by summertime, we're going to be getting back to a near normal, and that's gradually going to happen between summertime and the end of the year. I think by this time next year, I'll be on Facebook Live talking about what happened in 2021 and how things are opened up so much more between then and now. And so there is a lot of hope for 2021. A lot of it's based on the vaccines being here. And again, we talked about the distribution issues that they're ironing out those wrinkles. And so hopefully more and more people can get their vaccine. I think people are going to be able to travel to a certain extent, might require the vaccine to travel. It turns out, again, talking to Jia yesterday, Dr. Jia, he was saying that Qantas Airlines had said that they are preparing to require people to have vaccines for international flights. My guess is other airlines might be doing the same thing, so some type of vaccine passport might be required for certain things. And on top of that, I think we'll just have a better understanding of how to handle the virus, especially as society goes on. Now, one thing about this virus I want to say before I end up going to questions is coronavirus is going to be with us probably throughout our lifetime. And if you think about the flu, if you think about measles, if you think about these other things, especially those ones that the vaccines are very effective against, they're still with us. We just control them with the vaccine and public health measures. If there's outbreaks, we go in there and make sure those outbreaks are taken care of. But for the most part, we live our everyday lives with these viruses out there, and we just control the viruses through these public health measures, through vaccines. I think that's the same thing that's going to happen with coronavirus going forward. It won't be eradicated. It'll be here, but it'll be controlled, which is the important point. Now, again, talking about the variant, how in the UK they have this new strain of the virus, the B117, that is now over here in the US. More likely, it's already started to spread around the world. We just haven't detected it yet. And that's normal for viruses to change like that. We talked about distribution, how there's some snafus in the distribution, but those will improve quickly over time. And then we talk about 2020 and reviewing some of the things that, again, that we've heard about, that we knew about, and that have changed over time and looking forward. So let me see if you have any questions now.
If you've already had COVID, are you immune to some of the new strains?
So if you've already had COVID, are you immune to some of the new strains? We think you are. And the reason, again, is because the variant that concerns most people is that 117, that B117 variant out of the UK. And what's happened in that variant, and the reason it's concerned some people, is because the spikes on the virus themselves, and there's little spikes on the virus. If you look at the picture of it, and that's why it's called coronavirus, it looks like a crown with all these spikes on the outside of it. Those spikes are what let it attach to a cell, and once it attaches to the cell, it can start doing its work. Those right now are immune. If you've gotten coronavirus, your immune system is looking out for proteins in that spike, in those spikes. And once it detects them, and it starts attacking the virus itself and getting it out of your body. Now, in the spike, and this is what's a bit concerning about B117, is some of the genes in that protein, in that spike itself, have changed, but they haven't changed to the point where it can completely evade the immune system. And our immune system is very adaptable. So the thinking is that, yes, if you recover from coronavirus, you do have some antibodies. CDC says for 90 days, you are fairly protected from getting coronavirus again. So in that 90-day period, you are protected from this virus strain as well. However, once you get past that 90 days, this strain or other strains, we're not sure about the protection. And that's why the vaccine is important. Whether you've recovered from coronavirus, had it in the past, or whether you didn't have it, everybody's going to need the vaccine.
What if I don't get the second shot in time?
And actually they addressed that today. What if you don't get the second shot in time? And more particularly, what if you don't get the second shot? Well, what they found out is that first shot, and Pfizer came out with some information today, that first shot gives people around 50% protection. So not very good, but around 50% protection. And this is going back to the 2020 review too. If you remember back in February, March, Dr. Fauci and others were saying within 12 to 18 months we'd have a vaccine. Well, we ended up having one in about 10 months. And they were hoping it'd be 50 to 70% effective. Turns out it's 95% effective. And so much more effective, much quicker than we thought we'd get it. But the important point being here is if you get the first vaccine, you get about 50% protection. Based on the studies, and this is what Pfizer has said, based on the studies, we know that protection can last 21 days. But we don't know if it lasts much longer than 21 days because that was not part of the study. The study was looking at the 2 doses and getting you up to that 95% protection and making sure that lasted long term. And so what they're saying is don't rely on just getting that one vaccine. I know one of the theories are to get people one vaccine and then wait later for the second vaccine so we can get more people vaccinated. But the concern is people won't get that robust protection they need from that second vaccine. And so they want to make sure they vaccinate those that are most vulnerable with 2 vaccines.
I have been hearing a lot about RNA and mRNA and then DNA. What do we know about the? Can you tell us what the differences are?
Yeah, so the difference are DNA is basically the building blocks of our body. It builds, when you get DNA, you build these amino acids and you build these proteins. So it's basically do everything inside our body, include develop our bodies. Those are the genes we typically talk about. Now, part of that are something called messenger RNAs, which actually give messages on how to develop these types of proteins. The virus, this virus in particular, some viruses are DNA viruses, some viruses are mRNA, which are messenger RNA viruses. This one, coronavirus, is a messenger RNA virus, which is good and bad. The good part is when it gets into our body, it doesn't interact with our genes because it's basically outside that system of our gene development inside the actual cell itself. But it also can develop much more rapidly because it's messenger RNA. The good news about messenger RNA, it's easier to attack with these types of vaccines. Now, the two vaccines we're talking about in particular, Pfizer and Moderna, are both messenger RNA vaccines. So what they have done is they basically take a snippet of that RNA, put it inside the vaccine, get it inside our body, and once it gets into our body, it interacts with the cell, but not inside the mechanism that develops, that uses the DNA to develop our proteins. It's outside that mechanism, so it can't interact with it. And it causes it to develop these proteins that are similar, that are essentially the proteins of the spike on a coronavirus. And that's what our immune system keys into. And so that's basically the difference between those two.
Is food contamination an area that needs to be more focused on based on some of what happened this year?
And so, again, looking back at 2020 and some of the things in review, early on in the spring time frame, we were worried about food. Could this be going through our food system itself? And if you remember, there were even news articles about food coming out of China, frozen food that was possibly contaminated with coronavirus. And then we learned over time that this virus does not last very long outside the human body. And so because of that, we stopped worrying so much about food. Now, when it comes to food, and the USDA has said this time and time again, is you want to worry about your food like you would normally worry about it pre-pandemic. And so make sure you do all the food handling techniques you typically do to keep away salmonella, listeria, shigella, E. coli, all those other things that might contaminate your food. If you're handling that appropriately, then it's going to also prove to be appropriate handling for coronavirus as well. But as far as coronavirus spreading through our food supply, turns out that was not happening, and so we stopped worrying about that. Much like we stopped worrying about washing down all our packages and all those other things. We concentrated instead on what we call the 4 W's, and this is what I'll leave you with. The 4 W's, make sure that you understand the 4 W's and you use these going forward, because this is what's going to get us through the pandemic, especially before you get the vaccine, but even after you get the vaccine until we get enough people vaccinated. That's wear a mask, wash your hands, watch your distance, and then windows. Open windows, ventilate as much as possible. Now, I know a lot of you traveled over the holiday season. When you get back home, make sure you stay safe as possible, especially if you live with anybody who has any pre-existing medical conditions that could put them at a higher risk for complications. So for the next couple of weeks, essentially quarantine yourself, especially staying away from those people. If you decide to get tested, that 3 to 5 day period, maybe 5 to 7 day period, even better, is a good time to get tested once you get back home. And remember, your state regulations and rules might require you to quarantine beyond that, so talk to your employer about that. But again, looking back at what we talked about the variant, the UK variant that's here in the United States already. I always get asked, is it something people should worry about? It's not something you should worry about, but it's something you should certainly be aware of. And worry about it at the same stage you worry about the rest of the coronavirus that's out there. And that means doing the things you need to do to keep it under control. The mask, the social distancing, the washing your hands. And we talked about distribution, some of the snafus in the distribution. Those are getting worked out very quickly. And I think as next few weeks go on, we'll see even more robust distribution, more people getting the vaccines. And I think by summertime, we'll have enough people getting the vaccine where we can get life back to fair normal. And then 2020 in review, some of the things we learned about the virus, some of the things we know now about the virus based on those things that we learned, and looking forward into 2021. I truly think by the summertime, we'll start coming out of this. And by this time next year, we'll be back to what we are going to essentially be a long-term new normal, which will be occasionally wearing masks, being aware of this, getting vaccinated as we need to, because we're going to find out more about how long our shots will last for this virus, and then keeping ourselves healthy. But I think celebrating a year from now will be huge celebrations across the globe and across here in the United States. the fact that together we got through this pandemic, together we made sure we stayed as safe as possible, and together we realized that we could conquer things like this, but we can only conquer them if we truly do come together. And as the saying goes, it does take a village. And again, I want to leave you with my favorite quote of the year so far, and that's Winston Churchill's quote, which we always get asked, are we at the beginning of the end? And as he said, now this is not the end. It's not even the beginning of the end, but it is perhaps the end of the beginning, meaning we're through that first phase of coronavirus. We need to tackle this next part. We can't let our guard down. But hopefully, nobody liked the year 2020. It's almost beyond us. Once we get into 2021, hopefully a lot of optimism, a lot of understanding of each other and what we need to do to stay together, and how much as a community we work so much better. Happy New Year. I hope you have a fantastic New Year as best as possible. And as I like to say, 2021, here we come.